morning, Melissa. Welcome to our office.
Thank you.
I see by your chart here that you're interested in breast augmentation and breast lift. Is that correct?
That's right.
Okay. Let me just go over some of the basic concepts with you, Melissa, so that you understand what we're going to be doing. You, of course, will have several choices. You have your choice, of course, of saline or silicone implants. They each have their advantages and disadvantages. They're both very, very safe. If they do rupture, the silicone is what we call a cohesive gel, so the gel typically will not come out of the shell. It will stay inside. Even if it does, there has been so much research done on silicone gels. We know that they're very, very safe. So I would be very comfortable in telling you that gel will not hurt you in a medical sense. It will not cause disease based on the fact that it ruptured.
Okay.
The scarring will be quite visible for approximately 4 to 6 weeks. It's going to be red, it's going to be easily noticeable. But like any scar, it will mature over time. And we find that in most people that heal well, that within about a year, the scar is very, very minor.
Okay, good. That makes me feel better.
Of course.
And in terms of pain, what should I expect immediately following the surgery, and how soon can I drive and get back to work?
Very good question. The pain from the lift itself is really quite minor. I would say that discomfort is going to be with you for maybe 2 or 3 days, and then it really starts to fade. And I think by about a week or so, the discomfort is either completely gone or virtually completely gone.
Okay. And thirdly, the anesthesia. I know we're doing a sort of a conscious sedation. Is that what it's called?
That's what we used to call it.
Okay.
And that's also a very good question, Melissa. And anesthesia does have certain risks associated with it. As far as you're concerned, we're going to take you back to the operating room. Christy's going to start an IV. And very gently and very pleasantly, you're going to fall asleep. We're going to monitor a lot of parameters when you're in there. Most people have a very pleasant experience with MAC, monitored anesthesia care, or IV sedation. You'll fall asleep very gently, you'll wake up very gently. We don't use any opiates, we don't use any narcotics during surgery, and so the postoperative nausea and vomiting that some people experience, you won't have, because those come from opiates that we do not use.
Okay.
I think you'll find it to be a very pleasant experience.
Okay, great. Thanks for answering all my questions.
You're very welcome.
So Melissa, I know that you were speaking to Dr. Dennis about having your breast augmentation. I was wondering what brought you in to have it done.
Well, April, I've over recent months I've lost some weight and also lost a little bit of volume in my breasts. So I want to add back in a little bit of volume, nothing major, nothing outrageous, just to be proportionate, and see if I can get them right back where they belong, to a position and a size that I'm happy with, that feels right for my body.
So how did you hear about Dr. Dennis's office?
I have a friend who had surgery done by Dr. Dennis. She had just a breast augmentation. She didn't have the lift. She didn't need it. But her result was fantastic, and she's really happy. And so I think just that personal referral and that word of mouth, to me, means so much more than seeing an ad or a commercial or what have you. So.
Well, Melissa, thank you so much for sharing your information with us. Great to hear your story. I'm really excited for you.
Thank you.
And I know you're going to love your results.
Yeah, I think so too. Thank you, April.
You're welcome.
Melissa, it's so good to see you after your surgery. How are you feeling?
I'm actually feeling really great. I feel like I can definitely go back to work. I'm really happy with the results. I just personally, I feel really, really good, and I'm so happy that I had it done. So,
wow,
yeah.
He really got you up
He
there.
got me back where I belong.
That's wonderful.
Yeah.
I'm so happy
Thank
that you
you.
feel so good
Thank
and that it
you.
worked out so beautifully for you.